Good morning. I'm Dr. Zang, and I'm going to present today on the onychomycosis treatment with non-thermal lasers. On today's agenda, we're going to have a general description on the prevalence of onychomycosis, mainstay therapies for onychomycosis and their limitations, the history of it. We're going to also discuss the science of the cold laser therapy. We're going to compare non-thermal and thermal therapy. And this is something we're going to spend quite a bit of time on because this is it's very significant in dealing with the treatment of onychomycosis. And the clinical studies will demonstrate the safety of it, the efficacy of it. You'll actually see the effects that the laser has with each laser treatment. And hopefully you'll be seeing some things today that will be new to you. So onychomycosis, basically it's a fungal infection of the nail. The actual infection is of the nail bed, the germinal layer, and of the plate and the undersurface of the nail. It's not just in one specific area. And the infectious agent is what causes and permeates the keratin layers of the nail plate, resulting in discoloration, disfigurement, and that translates into pressure and pain. Onychomycosis it's a worldwide condition. It's estimated that 10% of the general population has clinical nail fungus. The United States has over 31 million people. Canada has 3.4 million. Mexico, over 11 million. Europe is 86 million. And in the United States, Medicare spends approximately $43 million a year to treat clinical nail fungus. $250 million is also spent on nail debridement of the mycotic toenails, and this was back in 1999. And this has been an increasing problem, and every year the percentage is going up. So the human nail plate does behave like a concentrated hydrophilic gel membrane, and that's the problem in utilizing the topical layers. And the nail layers possess all different barrier properties. So you have poor permeation of the drugs across the nail plate, and this necessitates long duration of therapy to maintain an effective drug concentration in the nail plate. And quite frankly, there are areas of the nail plate that it never penetrates, and that's why the success rate is in the 10 to 12% range with most of the over-counter medications and those that used to be prescription. And then also, like for example, Jubilee has FDA approval in the United States for treatment of onychomycosis, but they approved it with only a 17% success rate. So the problem is that the fungus produce a chemical which inhibit the production of phagocytes. This reduces the phagocytic numbers, and the environment is conducive to fungal growth. So it really is also a psychosocial disease as well as it is a medical disease. Mainstay therapies, griseofulvin has been around for probably close to half a century. It is very ineffective. At best, it's a 6% mycologic cure, and that's with 78 weeks of therapy and 77 weeks of follow-up. Terbinafine, 12 weeks, has the best success rate, and at 48 weeks, it's only 58%. Itraconazole, 12 weeks, and 72-week follow-up is 38%. And fluconazole as half a year and follow-up at 60 weeks at only 49%. The solution is cold laser or low-level laser therapy. Light penetrates the nail bed. You have a dual diode, which are two different wavelengths, which combines the antifungal effects of a 405 nanometer wavelength with the regenerative outcomes of a 635 nanometer wavelength. And the desired effects is to maximize photon concentration and treatment surface area to ensure that all infected tissue is properly targeted and treated. One of the things that we did with the laser is when we first started with this, I really wasn't sure how it was going to work. So what I did, I had a patient that came in with hypertrophic, elongated clinical nail mycosis, and I wanted to get a culture, but the specimen that I was able to obtain was significant enough that with a sterile nail nipper, I was able to debride the elongated, infected portion of nail. I then divided that specimen in half. One, without treatment, I placed, and it's on the left side of your screen, I placed into saborized media. And the other one, I was placed in a sterile container, and we administered the dual diode low laser photobiostimulation as per protocol for 12 minutes. And then that was placed in the media. And the difference is remarkable, and it's very, very obvious. So the way that the lunula and the dual diode device works is that this approach sets up an internal biochemical mechanism acting completely differently than thermal layers, which work just by cooking the fungal material. The 635 nanometer wavelength increases the immune constituents, activating the regenerative cycle. This mobilizes the body's growth factors to come to the area and increase mitochondrial stimulation, which produces nitric oxide. And this also encourages macrophage and neutrophil cells to migrate to the area. All of this increases vascularity and increases the immune response. The 405 wavelength, the lower wavelengths, increases reaction oxygen species, which results in the antibacterial, antifungal, and viral benefits. This produces superoxide dismutase. It's an enzyme resulting in lipid peroxidation in the cell membrane of the fungus. This degrades the phospholipids within the fungal cell membrane and causes cell death. So to go over this whole dual diode approach of cold laser combination therapy enhances the endogenous biochemical mechanism. 635 nanometer wavelength increases immune constituents by activating the resident macrophage and neutrophil cells, both of which are phagocytes. The 405 wavelength increases the production of reactive oxygen species, resulting in antimicrobial benefits. Reactive oxygen species produces superoxide dismutase, which is an enzyme resulting in lipid peroxidation, and this degrades the phospholipids within the fungal cell membrane, resulting in induced cell death to the fungal organism. It just enhances the eradication of the infectious agent, works to break down the infection, and accelerates the growth of clearer, healthier nail. And you'll be able to see this very vividly in later slides. And the 405 provides antimicrobial, antibacterial, and antifungal effects. So the research shows the application of laser therapy. It fortifies the immunological cells, increasing neutrophil and macrophage formation, and the intracellular activity generates active oxygen forms. The vascular abnormalities, which are present in many of our patients, especially in the 6th and 7th decades of life, increases the risk of patients with lower extremity vascular insufficiency to be more prone to developing clinical nail mycosis, period. Poor blood flow engenders immunosuppression, which prevents an adequate defense against the fungal agent. There have been several studies that have shown this to be the case. We do know that cold laser does increase mitochondrial stimulation, increasing nitric oxide and increasing ATP production, and this increases the circulation to the involved area. To this end, I actually took a Doppler ultrasound, and on the left-hand side, you'll be able to see the nail plate, the germinal layer, which has increased vascularity, and this patient was then placed immediately in the dual diode device, treated for 12 minutes as per protocol, and immediately afterwards, Doppler ultrasound was repeated, and you can see the dramatic increase in the vascular supply, almost involving the entire nail plate, the tissues, involving the germinal matrix area, which is all significant because that's an area where the fungal units remain pretty secure. They're immune from any hot therapy because you can't treat that area. And I can tell you that in subsequent studies, when you repeat photobiostimulation to the area, the vascular effects remain sustained. So the probable mechanism of action, just to review, is a combination of the 405 nanometer and the 635 nanometer wavelengths, which produces acidic nitric or peroxynitrate. The 405 wavelengths produces reactive oxygen species, 635 produces nitric oxide, and combined they produce the peroxynitrate, which causes the destruction of the fungal pathogen. The science of the 405, as you lower the wavelength, the energy will proportionally increase, and as a result, this wavelength contains markedly higher energy levels per photon. This triggers a more pronounced photochemical reaction, resulting in cell death. The generation of molecular oxygen in its excited single state is believed to be the primary cause of cell damage in conjunction with photodynamic therapy. The oxygen species is generated by transfer of energy from the photosensitizer in its excited triplet state to molecular oxygen. In the transfer, the photosensitizer relaxes to its ground state from where it can again be re-excited under the influence of therapeutic coherent light. This repeats the cycle. Photooxidation continues with the oxygen, molecular oxygen is rapidly activating many cellular components such as unsaturated lipids, proteins, nucleic acids, etc. The diffusion length of signal oxygen is between 1.01 over 0.04 micromilligrams, which is less than 1% of the diameter of a red blood cell. And red blood cell diameter is approximately 7 micromilligrams. The photosensitizer is lipophilic, and this accumulates in the plasma and cell membranes, and this photooxidation can result in direct rupture of the cell membrane of the mycosis. Now we're going to go to the area of the thermal and the non-thermal lasers. The differences are significant, and the non-thermal laser that we're using is initially, years ago, it was thought to be a class 3, but it really is a class 2 laser. The thermal layers are all class 4. The cold lasers wavelength vary from 400 nanometers to up to about 650 nanometers, whereas the hot lasers start at 870 and can go up to the surgical lasers of 1320. There is absolutely no heat generated with the non-thermal lasers, and there's a significant heat, surgical heat, burning and destruction of tissue with the thermal lasers. In fact, with the non-thermal laser, the highest that the treated temperature can get is 37 degrees centigrade, which is 98.6 degrees Fahrenheit. You cannot burn the tissue. The spot size is 8 inches or so, where the spot size with the thermal lasers are 2 to 4 millimeters. There is complete coverage with the non-thermal laser. There is incomplete coverage of the therapeutic area with the thermal layers, and the antimicrobial antifungal effects are present with cold laser therapy. There are no antithermal, there is no antimicrobial or antifungal effects with the thermal lasers. They just work by eradicating the tissue by burning the tissue. If any of you have been around or in the room when they've utilized the class 4 laser, you can smell a little bit of the laser plume. Sometimes you can even see it. Laser plume. Laser plume is not present with the non-thermal lasers. It definitely is present with thermal hot lasers. And when you're breathing the plume, you, the patient, and anybody else in the room, you're actually taking into your lungs active microbial tissue, whether it be fungus or bacterial or even virus. There is quite a bit of danger. There's no pain generated with the cold laser. There is pain generated with the thermal lasers. When patients receive thermal laser therapy, they constantly have to be asked if they're feeling any pain. The problem is when the patient tells you they're feeling pain, it's already too late. There is a definite risk of burning tissue, which you'll see in a subsequent slide. There is no risk with the cold lasers. Cold laser therapy is safe for use in the diabetic foot, in the devascularized foot, and in the insensate foot. It is not safe for use with hot lasers. There have been no reported complications with class 2 laser therapy. There have been significant complications reported with hot lasers. And with the cold laser, you are able to treat the entire nail, plate, and germinal layer. With the thermal laser, you are not able to do so. This is a slide was actually produced in 2011 after the first hot lasers became available. And this was through the European Academy of Dermatology and Venereology. And this is 2 weeks after the YAG 1064 nanometer laser therapy. This was on a patient that had an insensate foot. This clearly is a problem. When we talk about the coverage with the thermal laser, you can see you have to treat it with the spot size. You are unable to treat the germinal layer, and that's why there's such a high recurrence rate. On the dual diode laser, this covers the entire area. The beam is close to 8 inches. It's in an enclosed box, which you will see later, and all tissue receives photobiostimulation. So you are actually targeting and hitting all of the diseased tissue with the cold laser, not so with the hot lasers. And if you miss a spot, these are hotbeds for the resurgence of the mycosis. And you can see how the whole nail is treated. So there were several research studies done. Concurrently, there was one research in Europe with Dr. Sullivan in Ireland, and his study pretty much paralleled our study, and we had very little communication when these studies were going on, but our results were very similar. So his study, he had 84+% effective over 48 weeks with nails treated up to, that were nails that were treated that had up to 80% involvement with the nail plate. 51% was effective with nails that were totally included and were dystrophic, and these involved the nail matrix as well as the germinal layered unaligned portion of the plate. And it was very significant because we have another subsequent study where we increased the success rate from the totally included nails to over 90%. We'll go over that a little bit later. So in his study, this is the top and the bottom are the results. This is 48 weeks from Dr. Sullivan's study. I think these pretty much speak for themselves. When you look at this slide here, this nail, look not only at the great toe, but look at the second toe. And you can see at the 12-week period, the nail is less angry looking. It is starting to grow out. The second toe is clearing. And at the end of 48 weeks, close to a year, great toe, second toe, relatively clear. So if we go ahead and look at another picture, baseline on the left, you can see the involvement at 4 weeks and at 48 weeks. When you inactivate and you use a laser to treat it, you inactivate the actual disease process. However, the nail becomes a little bit thinner. It looks like it's still mycotic, but the activity level is stopped, and it's stopped, and it's more evident with each laser treatment. In his study, same as in our study, we treated them with once a week for 4 treatments, and then we followed them up. And you can see the difference here. Again, look at the second toe as well. So in the study that we have done, our study was a little bit different. We had objectively to assess the efficacy of the cold laser for treating mycosis. What we did, we used a 635/405 nanometer wavelength. We treated the affected toenails, and we had 2 groups. One we treated for 12 minutes for 2 weeks, and the other group for 12 minutes each session for 4 weeks. The measurement for our FDA study included the 50 great toenails, thickened discolored nail plate, confirmed with culture and sensitivity. And the outcome for our FDA study was to provide 3 millimeter of clear nail growth during a 6-month period. We've followed many of these patients up for the full year, ending up with very similar results that Dr. Sullivan did. We ended up with a 89% increase in clear nail space across a 6-month study period. No adverse effects were reported. Conclusion, non-thermal therapy is safe. It's effective for increasing the extent of clear nail in onychomycosis infected toenails following 1 weekly treatment for 4 weeks. What we've done, we're going to show you some of the study patients that were there, so we can just compare them, and you can see what happens before and after. So when you look at the nail plate here, you can see the line. This is a laser line. You can see a little bit of line over here, here. Each time we go ahead and administer the laser, you can see the nail becomes thinner as the new nail grows out, and the space is increased. So at 6-month period, we had 10.75 millimeters of clear nail growth. This went on to full growth at the end of the year. So we had 87% clearing at 6 months. And the positive response to treatment was achieved absent any adverse effects. So some of the other results, when you look over here and you can see basically where we started. These were in the FDA study at 6 months. You can see each laser line. You can see a laser line here, a treatment, another second treatment here, and this space is not that great. Third, well, I'll show you over here. Over here we have a laser line, another laser treatment line, and you can see very distinctly when we're finally getting complete clearing, how the nail is growing out normally. And as it grows out, it becomes thinner, looks less angry, and becomes normal. Again, you can look at the laser treatment lines as a nail grows out. Clear space is pretty important. This is also dramatic, and you can see the first treatment, second treatment line, third line, and the fourth treatment was here, and everything is clear after that. These responses, and you can look at the second digit, because when we treated it, we used the great toe for the study, but we actually treated all 10 toenails. This was without any coordinated treatment. Again, I mean, these are really pretty self-explanatory, and this is safe. And when you look at this here, you can see this is the treatment, and you treat all 5 toes. If you have a large practice, you can have 2 units, so both feet can be treated in a matter of 12 minutes. It's non-invasive. It is painless. The worst thing that can happen with this is nothing. The treatment protocol that we used in the FDA study was once a week for 4 weeks, no adjunctive therapy. And then we followed them, and you saw many of those results. Currently, our current treatment regimen, we initially treat them once a week, the same protocol. We dispense a topical over-the-counter antifungal cream to prevent any reinfection. We sanitize their shoes with ultraviolet light in the office when they're receiving the treatment. We give them an antifungal spray that they can use to sanitize their shoes when they remove them, so that they always put on shoes that are sanitized. We reevaluated the patients in 16 weeks. If additional therapy is indicated, for real resistant cases, we can always add additional treatments at that time. And patients that are in the 87% success rate, they're concerned about having a recurrence. They're invited to come in. They can come in for a one-time treatment to help prevent reinfection, to keep the area sanitized. So no systemic options are attractive, and without the potential for liver toxicity. The treatment is non-invasive, painless. It treats the condition, not the symptoms. No adverse reactions, no drug therapy, safe, and no complications have been noted. This is a game changer. And I know there's been comparisons, or I understand that in Canada, they looped all the therapies together, cold and hot. And you really can't do that because they're totally different. And there are concerns with hot lasers, and there are no studies from the hot lasers. They're only utilized to clear nail space temporarily. But anyway, I hope this has been helpful, and thank you very much.